orthodontist, the patient will suffer. That's for sure. Because preparation for the prosthodontic treatment by the orthodontist is the easiest way. You have only aligned the teeth. Only to align them, because the rest is easy. If the teeth are not aligned.
I don't think it's not the scientific approach that makes dentists not to send. It's again
a money approach.
I believe the economic approach, because I see that people that I send, I try to use CBCTs if I see multiple treatment that it has endo, fillings, restorations. Well, I try from the beginning, if the patient says that I will start, I try to send for, it's hard to send a patient to a CBC, to make a CBCT. And the doctor is afraid that I will
lose the patient.
I will send him for the CBCT,
and he will vanish.
Disagree. He will go to another doctor that will start without the CBCT, doing endo, doing prosthetic.
You know, guys, there is thing in psychology that is called need. You know, when two people are in the room, one of them has a need, one of them is trying to resist the need of the other. So when a patient comes to you and you want to treat this patient because you need money, you have the need, and patient just he will not even acknowledge that. He will resist this need because doctor wants to take me as a patient, and inside he would resist to that. If you do other way around, I don't need this patient, I don't want to treat this patient, I want to get rid of this patient, what happens usually? Patient doesn't want to go. Patient wants to be with his doctor. Why? Because you created the resistance to his need to be treated by you. So in this way, I don't think that we have to be afraid of those patients who will not do CBCT for our treatment. I think we have to be afraid of the patients we don't have CBCT in the beginning. And I know it's hard because the mentality is like that. And I suffered a lot because of that, because I lose a lot of patients when I told them I have comprehensive approach. I will not do this because I don't think that morally is good, to grind your teeth because you don't want to align them. And I lived long enough in my practice to see how they're coming back. Humiliated, saying, finally it was the same amount of money, but look what happened in our mouth. We understand now.
Yes,
and you say this, you keep these patients and you say, okay, you're setting good example, I will help you because I can tell others. When the patient says to me, your clinic is too expensive, I say, well, it may be expensive, but actually the clinic I work at has the policy of transparent pricing. It means that we give all the prices in the beginning. There are no hidden prices that will just arise during the treatment. Oh, we forgot to tell you, but you have to pay for abutments or for temporaries because, we were calculating all the implants and final prosthetics. So we give everything in advance, and the treatment plan is quite expensive when they see all the list and everything they have to pay. They say, no, it's too expensive. In other clinic, it's less expensive. I tell them, well, I'm not sure about it because I'm not sure that they count in everything like we do. But you go there, please do the work there. I'll be happily retreating you later. So, I understand, and Panayiotis told me that, Greek dentistry. I think, guys, you are here. Maybe you are first to change Greek dentistry. Look,
yeah, it's a different culture because here in Greece there are only small clinics with 1, 2, or 3 maybe doctors. They're not like the
majority. One doctor.
Yeah.
The
Okay.
majority of
Like US,
yeah,
like US,
yeah.
like in US, yes.
And
But
one doctor cannot do everything, and cannot do the diagnostics, cannot do the planning, can't do the treatment. But he's one-man show.
Yeah, one-man army, yes.
Yes.
And well, it's a matter of what you believe in, because one-man army is not profitable, I think. For example, imagine, do you do a lot of dentures? You do a lot of dentures. Do you do a lot of ceramic?
Yeah.
Do you do dentures better than ceramic or ceramic better than dentures? or you do both with a good quality?
My lab do this.
Okay,
Not me.
if you're one-man army, you're a
Yeah.
technician. I know
No.
technicians who like to work with acrylic, and they feel acrylic, they like to play with, and when they see ceramic, they're stressed. I know technicians who work only with a brush, and when it comes to acrylic, to something like that, they're stressed because, well, I'm an artist, I want to paint ceramic on a teeth. So in labs, you found a solution. You have everybody in charge of everything.
Yeah.
But you are capable of doing all the work. But you know that you're good in it. So you'd better do it more often, what you're good at, and you can raise your prices. Like, I can try to be an endodontist. What kind of an endodontist I would be? I know what I'm talking about because I was prosthodontist and orthodontist. I quit orthodontics because I realized that it steals me from my prosthodontic patients first, because my schedule was full with orthodontic patients. I didn't get a lot of money. Like, I had more patients but less money, and in the end I was frustrated with the result I was producing. So when my wife mastered the multi-look technique, and I've seen it, I said, no, let's stop it. Let you be orthodontist and I'll be prosthodontist. I am not, I would say, thinking it as a 10 years of my life and to go wasted, because I know orthodontics, I can do diagnosis, I can see which is real or which is not, but I will not practice manually with orthodontics. That's what I think prosthodontist is. Prosthodontist is someone who knows all the dentistry, everything, periodontics, endodontics, surgery, but manually he keeps on doing some small part of dentistry, but he has to plan for everybody. That's what I believe in. And being a prosthodontist, if I would be doing everything else, I would be less successful, I would say. Because there will be some procedures, for example, I do endo, but I'm not a good endodontist, because to practice endo, you have to practice every day like you're playing piano. If you don't play piano today, tomorrow you're not a good piano player. Every musician knows that. If you don't practice one day, you're wasted. So endodontics is the same. You have to hold the files every day in your practice to feel the canal, even with a microscope. So imagine I'm doing endo, and I'm breaking the instruments, I'm doing perforations, and then I'm doing beautiful, beautiful crowns on this. What else? Well, imagine I'm a surgeon. I place implants, but I suck in soft tissue grafting. So, in a way, you're profitable, then you do something you do best.
So, sorry, I have to go now, I will go back.
Okay. So we'll do the most interesting part right now while you're absent.
Yeah.
So let's go back to our patient. Right now we did the routine part. Yes.
One question. В моем случае, помимо хирургического вот это все поднимать, вообще-то начинать же с ортодонтии надо, если остальное решить, что с хирургической.
I'm not sure yet that you need to start with orthodontics actually.
А в процессе? По факту, после, в процессе протокола лечения, имею в виду.
Well, what I see right now,
Okay.
that I don't see a lot of indications for orthodontic work here. For example, actually you are the case where I would